Thank you for joining us on another episode of Talk Time on Lugardtv. I am Dominion Adeonju, and joining me today is Dr. Oluseyi Folagbade, the Acting Chief Medical Director, Kogi State Specialist Hospital, Lugard. Today in the studio, we'll be discussing about the current state of the hospital, challenges, and the way forward. Thank you very much for joining us today, sir.
Thank you very much for inviting me.
Thank you, sir. How is the hospital doing?
Yeah, doing very well.
All right, sir. What has been your assessment of the state of affairs at the hospital since assuming office?
Thank you very much. First, I want to appreciate our good governor, Alhaji Usman, for appointing me in the acting capacity of the Chief Medical Director. Since assumption of duty from the 10th of March 2025, I've gone to work immediately to ensure that we return belief in the system, in the hospital, and also I've ensured that the staff rise up to what they're supposed to do in terms of patient care. So generally, in terms of we delivering service to our people, it has been better, and we've gotten better response from our patients, and also in terms of delivery from our staff.
All right, sir. What is your take on challenges of inadequate medical equipment and personnel in the state's health system?
Yeah, since assumption of duty, we've gone to work immediately. We've looked inward, and first, we've tried to make good use of what we have. During the tenure of our former governor, Yaya Bello, he provided for us 2 dialysis machines, and we've been able to put that into use, and can now say that we've commenced dialysis services to the people of the state. Okay. Also, we've been intentional about getting new equipment. I was able to reach out to some of my friends in Australia when I went for my postgraduate training, and a company there donated an X-ray digitizer for us. So we're also commencing offering digital X-ray services in the hospital. And also, we've been able to get a state-of-the-art 4D ultrasound machine, which also has an echo probe. So we are offering premium state-of-the-art ultrasound helmet. Right. And also, we received a state-of-the-art operating microscope for ophthalmology. So we're also recommencing offering eye surgeries in the hospital, especially cataract surgery. So we're trying to do a lot in this short time.
That's highly commendable, sir. The main aim of the hospital is, of course, to attend to patients and the rest. So what plans have you put in place to improve patient care and service delivery in the hospital?
Yes, first is to build trust from our patients. And we've highlighted what the patient needs and what we are supposed to do. When I came on board, I brought in a mantra that I called CARE. The C there stands for commitment, communication. A stands there for availability, R for relationship, and E for expertise. And this has been what has been pushing us forward in what we've been doing. In terms of getting drugs when the patient comes, we've been intentional about that. We've ensured that drugs are available, and we've set up mechanisms in case we have scenarios where some of the drugs that they have are out of stock. They are immediately procured. And also in our lab, we've been intentional about that, to getting reagents so that the necessary investigations are carried out as at when due, and then patient can get better care. And from the staff, we've tried to boost their morale so that they are always available where they're supposed to be available, and also the way they communicate and relate with patients are better.
All right, sir. Of course, if the caregivers are not in the right state of mind, they can't, of course, do their best to the patient. What strategies have you adopted to ensure staff welfare and, like you mentioned, boost morale among healthcare workers?
And one of the first things I did was to institute what we call the Staff of the Month Award, whereby a staff in the hospital is identified and then is given an award just to encourage everybody to put in their best. Okay. And it's such that it is rotational. Anybody can get the award, don't have to be at a senior staff. In fact, the first time we started, it was a junior staff that got the award, and that really boosted the morale of staff, and everybody now is working better because everybody wants to get that award, wants to get that recognition. And apart from that, I've been intentional about the staff welfare, ensuring that what they're supposed to get is they get it. And let me also quickly commend good governor for the timely payment of salaries that has been so good. That alone has boosted the morale of the staff. Payment of leave bonus also is something that is very, very commendable. All these have been making sure that our staff put in their best.
All right. How will you ensure transparency and accountability in the management of hospital resources?
Yes, thank you very much. In the hospital, and immediately I got to work, we set up a procurement unit such that all our procurement, they follow the standard as itemized in the Procurement Act. And also, we've been able to reconstitute the Revenue Generating Committee, whereby we meet monthly. All the generating unit service points, we meet monthly, and then we look at what we're able to generate, and then we also compare that with our expenditure. And there also, we analyze what our budgetary projection is for that month, and we compare if we're able to meet up or not. And I can say that we've been able to meet up more than 90% of what we're supposed to meet up with. And I also want to appreciate the governor for giving us that privilege. So far, still be able to attract some specialists into the hospital, and also some medical officers also have joined us. And for the first time in a recent while, we also gotten some core members who are doctors to come and serve in the hospital, and that has also complemented the workforce that we have.
Okay. Personally, on your side, have you had any challenges trying to fit in as the new chief medical director?
Well, not really, because I've been in the system. I was employed as a consultant gynecologist working in the hospital, and I was also the head of department of obstetrics and gynecology, which is, I can say, the major department in the hospital. So I've been in the system. I understand the workings of the system. I know the staff know me, and that has really helped me to get to work immediately and then be able to achieve some things in a little while.
All right. Finally, before I let you go, what is your assessment of the health sector in the state under Governor Ahmed Usman Ododo's administration?
Really, I want to really appreciate our good governor for everything he has been doing at all levels of healthcare in the state. From the primary healthcare level, he has strengthened all the primary healthcare centers. The Primary Healthcare Development Agency, headed by my good brother, Dr. Muazu, they are doing very well. The secondary level also, heavily headed by the Chief Medical Director of the HMB, Dr. Layami Ayo, they're also doing very well. And also, we have complementary services from all the other agencies. The Kogi State Health Insurance is doing very well in enrolling a lot of Kogi indigents, the formal sector, and now the pensioners have also been added, and that has really helped the people of the states in which the payment of for healthcare with money from your pocket has drastically reduced. And also at the tertiary levels, the Kogi State College of Health Sciences at Okene, and also at Prince Awaka University, has strengthened this. We can also say that we've gotten accreditation once again to start medicine at the university. And right now, we can say that within the state, we are training students to become doctors, and the health picture for the state is looking good. Because very soon we'll have our state-owned doctors that are trained from within the state. And also, let me use the opportunity to also say that plans are also in top gear to commence asthmatic training at the hospital. Our governor is also looking in that direction, and a lot of things are happening under the scene to ensure that very soon we'll start training doctors for asthmatic within the state. And the governor really done so much from across all levels within the healthcare delivery state.
Thank you very much, sir.
Thank you.
Sadly, I'll have to let you go now. Thank you for joining us today, sir.
Thank you for inviting me.
That is it on Talk Time on Lugard TV. You've heard from Dr. Oluseyi Bamidele on the current state of the hospital, the challenges, and way forward, of course. Until next time, I am Dominion Adeonju. Thank you for staying with us.